All right, so this is the slide that I said I'm going to ask you some questions, and what I'm going to do as I show you this graph, when I ask you a question, stop the video and see if you can answer it. I have a worksheet that I'll do in class, but this is getting you used to blood flows through valves, or valves open and close, in response to pressure change. So blood flows from a high to a low pressure. Now, looking here, the green line represents, this is just showing the left side of the heart, by the way. So the green line represents the changing pressures in the left atrium. The blue line represents changing pressures in your left ventricle. And the red line represents changing pressures in your aorta. So we're going to see that blood flows from whenever pressure changes happen. All right, so here you see there's, it's showing when our bicuspid valve closes. Bicuspid valve closes after your atria has pushed blood into your ventricle, and then your aortic valve opens after tension in your ventricle overcomes tension in the aorta. Whenever we eject blood into the aorta, aortic pressure goes up, your aortic valve closes, and the pressure in the ventricle continues to drop. This dicrotic wave is also called the dicrotic notch. That is because the blood that went out into the aorta, this is in a higher pressure now, so it wants to go back to the ventricle that it just came from, but it kind of bounces off of that closed aortic valve and comes back. Also, the aorta has a little bit of stretch in it, so it kind of stretches out and then snaps back as soon as blood goes into it. So that's why you see this little dicrotic wave. Okay, first question. What event occurs when the pressure in the left ventricle rises above that in the left atrium? So think about that question. What event occurs when the pressure in the left ventricle rises above that in the left atrium? So stop your video and see if you can answer that. Okay, when the pressure in the left ventricle, this blue line, rises above the pressure in the left atrium, the green line, that is right here. This is kind of easy because it tells you. Your event, the bicuspid valve closes, the left atrioventricular valve. Next question. During ventricular systole, what is the blood volume in the atria doing? Okay, so during ventricular systole, the blood volume in the atria is increasing. Now that one is hard. Ventricular systole means when the ventricle is contracting. Well, notice that when our ventricle is contracting, our atria is relaxing. One thing you can think about is when a chamber is relaxed, it's usually filling, and when it's contracting, it's emptying. So when my ventricle is contracting, my atria are relaxing, and my left atrium is getting blood from the pulmonary veins, and my right atrium is getting blood from the superior and inferior vena cava. During ventricular systole, what is the blood volume in the ventricle doing? So during ventricular systole, what is the blood volume in the ventricle doing? Well, in ventricular systole, that means contraction. If my ventricle is contracting, it's ejecting blood, so our volume is decreasing. Right? Next question. During most of ventricular diastole, the pressure in the ventricle is what than the pressure in the left atrium? So I'll say that again. During most of ventricular diastole, the pressure in the left ventricle is what than the pressure in the left atrium? Okay. During most of ventricular diastole, so when the ventricle is relaxed, the pressure in that ventricle is most of the time less than the pressure in the left atrium. Why is that? Because if our ventricle is relaxed, our atrium is contracting. And when our atrium is contracting, it's pushing blood into our ventricle. And we know blood flows from a high pressure to a low pressure. So during most of ventricular diastole, when it's relaxed, the pressure in that ventricle is less than the pressure in the atrium. That's why blood is going from atria to ventricle. All right, next question. What event occurs when the pressure within the left ventricle, so blue line, left ventricle, becomes greater than the pressure in the aorta? So again, what event occurs when the pressure within the left ventricle becomes greater than the pressure in the aorta? Should have seen there that whenever the pressure in the left ventricle becomes greater than the pressure in the aorta, the aortic valve opens here. Right here is when the pressure in the left ventricle becomes greater than the pressure in the aorta. Okay, next question is going to be the hardest one. Everybody usually gets this wrong. So during isovolumetric contraction, remember we just went over what isovolumetric contraction was, when the chambers are briefly closed and full in your ventricles. Where is the pressure the highest? So during isovolumetric contraction, where is pressure the highest? Okay, this one is hard. Our aortic valve has not yet opened whenever we're in isovolumetric contraction. Remember, that's the brief time period before they open. Pressure's highest in the aorta. Your atria is down here, and this whole graph wouldn't be formed yet. So if we're right before here, our pressure is higher in the aorta. It would also make sense to think of it this way. Because the continued contraction of those ventricles causes pressure inside the ventricle to rise. That's why we're doing isovolumetric contraction and building tension. It has to overtake the aortic pressure because it's pressure changes that open those valves. So the aortic valve is only going to open when pressure in the left ventricle exceeds pressure in the aorta. So if our question is isovolumetric contraction, that is before pressure in the left ventricle exceeds pressure in the aorta. So the answer there, during isovolumetric contraction, pressure is the highest in the aorta. So you might want to stop and think about that for a minute because that one is really hard to see. And finally, last question here. During what part of the cardiac cycle is blood pressure the highest in your large systemic arteries? And when I say large systemic arteries, I mean after it goes out from the aorta to all of the arteries in your body. So during what part of your cardiac cycle is blood pressure the highest in large systemic arteries? The answer there is during ventricular systole, and you probably wouldn't see that very well on your graph, but that would be during this time period because we've already pumped out some blood and there's a lot more pressure and there's big arteries like your aorta as well. So I know that that can be confusing. If you have problems understanding the pressure in those questions, I think it is the hardest part of cardiovascular physiology. So please email me and ask questions. Feel free to schedule a Zoom meeting and we can go over that a little more. But it all has to do with this graph. That's what the point of this is, just to understand pressure changes. So blood flows from an area of high pressure to low pressure, and therefore valves open in response to overcoming those pressure changes. Now this is just a little graph showing the volume of the ventricle. At the end of atrial systole, we said our ventricle is full at about 130 milliliters, and that varies a little from person to person, but that's average. So a normal end diastolic volume is 130 milliliters. After ventricular systole, and we have ventricular ejection, when each ventricle pumps out blood, they tend to pump out about 70 milliliters. That's a normal stroke volume. So we end up with an end diastolic volume of about 60 milliliters. So this is a nice active slide. I'm going to click through it. You may want to do this a couple times just to put all the concepts we've talked about together. But we've got our EKG, we've got the phase and the timing of some of your cardiac pieces of the cardiac cycle. We've got our pressure graph. This is showing heart sounds. This is showing that volume graph that I showed in diastolic volume, in systolic volume, and stroke volume. And here are the phases of the cardiac cycle. So one thing that I haven't really talked about, we said the first heart sound, I call it the lub. So if a heart sound is lubbed up, is called sound one. Sound one is made whenever blood hits closed tricuspid and bicuspid, closed atrioventricular valves. Sound two is made when blood hits closed semilunar valves, aortic and pulmonary valves. And S3 and S4 should not normally be heard unless you have an abnormal heart rhythm. And I talk about that in a video that I posted in lab because I don't talk much about those gallop rhythms in lecture. But for instance, these might show up if you have an atrium that's working really hard to overcome a hypertrophic ventricle. But normally those S3 and S4 wouldn't be heard. So here, we start out with a P wave, atrial depolarization. Our SA node fires and we start to depolarize our atrial fibers. After atrial fibers have depolarized, then we can begin atrial systole, where we see this green line going up in pressure. And then after our atrial systole, we have a full ventricle, so we've got our end diastolic volume. Each ventricle has about 130 milliliters when it's full. Number 4, after we have pumped blood out into our ventricle, now we can start to depolarize our ventricle with our QRS complex. After the QRS complex is formed and our ventricle fibers are depolarized, then we get our isovolumetric contraction, where for a brief time period, our AV valves and our SL valves are closed, and our ventricles are isometrically contracting, trying to overcome the pressure in the aorta. Once they have done that, then you can begin ventricular ejection when our aortic valve is open, and then pressure in our aorta is rising. After we have ejected blood from our ventricle, then we have our end systolic volume of 60 milliliters. So we pumped out a normal stroke volume of 70 milliliters. After that, we have ventricular repolarization. So we can begin ventricular repolarization by forming our T wave. Once our T wave is formed and our ventricular repolarization has happened, we have vasovolumetric relaxation, where once again, air kind of empty, not totally empty, halfway empty ventricles, are a closed chamber before the atrial pressure exceeds the ventricular pressure. And when that atrial pressure exceeds the ventricular pressure, then those atrioventricular valves open and we can begin ventricular filling phase again. And notice that these graphs are showing the left side of the heart, since the myocardium in the left side is a little bit thicker, but it would be very similar for the right side of the heart. They just usually use the left side for an example. So go through that slide.